Welcome to the Be Well Network program. My name is Dr. Ted Bender. I'm a clinical psychologist and the CEO of the Be Well Network. Please like and subscribe to our channel to stay educated about mental health and addiction. If you or a loved one is struggling, please visit BeWellRecovery.com. My goal in this program is to educate people and to help many understand that they are not alone. Today we have comedian and actor Eric Griffin, and we're going to speak about mental health and addiction. Welcome, Eric. Thank you so much for coming to the studio today. We're honored to have you here.
Yeah. It's, let's get into it.
Yeah. You've had an amazing career from the show Workaholics to being in many films and having your stand-up comedy on all kinds of networks and shows. I know you're not in recovery yourself, but I imagine in the life that you've lived, you've seen quite a bit of addiction and mental health. And
yeah, I mean, someone that I consider like a brother to me is like, because I don't have a big family at all. So this is like family to me. He's in recovery. He's an addict, and it's tough. You have a lot of misconceptions about addiction when you're not, because I don't drink. I never have. I've never been drunk in my life. I just made a choice. I didn't want to do it. No, there's no spiritual reason or anything like that. I just made a choice. But anyways. And so you have these misconceptions about what you think addiction is and and how it affects the loved ones. It's a lot, So even if you're around someone that needs addiction, I have PTSD from it. You know what I mean? So I had to go to my own therapy just to deal with my own guilt of feeling like I enabled this and that kind of stuff. So
yeah. You're absolutely right. There are a ton of misconceptions around it. Even to the lay public who's never dealt with it, but at this point in time, almost everybody has, in some form or fashion, been touched by addiction. But even when you're in the grips of it, whether you're dealing with it yourself or you're, like you mentioned, have a very good friend who's suffering from it or family members, there's often, like what you mentioned, the enabling behaviors. And from my experience, many people don't even understand what that is or how they're enabling other people's addiction.
Because people say there's always this thing outsiders look in and they go, you gotta let them hit rock bottom.
Yeah.
And that's a tough thing because what you're saying, it's doing what's right for someone else at the sake of your own feelings. It's you care about this person. Yeah. You don't want to see them suffer. And usually it's a loved one or a family member. And you're just, and you're like, well, what am I supposed to do? Let my family member just suffer? And so but what's weird is being in it, you have to do that. But it's a really tough choice. And then you have guilt because anytime you were like, well, I made sure I gave them money. I didn't want them to suffer. I paid their rent because I didn't want them to get kicked out. And I did. So, and then you see the result of it later and you're sitting there going well, was this my fault? Could I have done more? Should I have done better? And so you have your own feelings. That feeling of guilt is so hard to deal with and the responsibility you feel. You really take on the responsibility of I have to make sure that my friend, my loved one is okay. And you're not equipped for that. We're not equipped to deal with an addict.
Definitely not.
You know what I mean? And so it's and that's where, your own mental health comes into play. That's why Al-Anon and things like that are come about. Talking to a therapist or talking to in a group setting with people that understand. Because there is something about when you've dealt with an addict and you talk to someone else who's dealt with an addict, it is so empowering to know that you're not alone.
Yes.
To talk to somebody, because these moments, because the outside people, they don't know. They don't even understand. Why would you do that? You just don't give them money. Yeah. And it's okay, I can't talk to you. You don't really understand until it's you're in that situation. But when you talk to someone else and you go, hey, you these feelings that you have, and someone else goes, yes. And then you could just go, oh, okay, I'm not alone. And so how do I deal with this?
I can tell you, working with people who are suffering from these disorders, oftentimes we spend a lot of time working with the family members. And we get all kinds of reactions from family members, specifically around topics that you're talking about. Sometimes they'll be like, well, what do you mean you have to work with me? I'm not the one with the problem. Right? But a lot of times, a lot of times, a part of the problem is the enabling behaviors that you're mentioning, how to deal with that. And, knowing that you're not alone in that is incredibly important. That's why the support groups are so critical. We see this a lot in family members and friends and spouses and parents. And a lot of times, not to stereotype it, but a lot of times when it comes to kids or teens or young adults, it's usually the mom and that is one that's doing the enabling. Although dads do it too. Yeah. They're the ones that are just resort to anger, as men do best, and say, "Oh, I'm not dealing with it," and throw my hands up. But in a way, that's also enabling it.
Yeah, it's a tough thing. It also, it's you have to unpack all these things. So it's if someone's an alcoholic or you understand that, like, actually the person is self-medicating to deal with some other pain. Now, that's the part that, like, once you wrap your head around that, then you actually can feel better about, instead of enabling, trying to get this person help. And that's the tough part, is because they have to want help. The first time I dealt with this is like, I helped my friend get into a treatment, but he didn't really want to do it. It was just like, hey, you have to do this, or
or here's the consequences.
Right, but those consequences don't really mean anything to somebody who's like,
Yeah.
But it was fine for a little while, and then shortly after, it was like, well, I'm drinking again, and because the pain was still there.
Yes.
Whatever the person is really dealing with, and they just don't have the capacity to deal with, like, the trauma in their life. In this particular case, my friend's mother died of cancer when he was very young, and just a lot of things that happened to him that, has affected his life, and so this is how he dealt with it. It's not a great choice, obviously, but just understand that choice, and then now you can start to go, okay, so he needs to deal with, like, that self-worth, insecurities, and all the things that make people go, when they can't deal with it, they go, I'm going to turn to blah, blah, blah. That's one of the reasons why people do it.
Yes.
Some other reasons is also because it's like, this is a drug that's addictive.
Yeah.
You know what I mean? That's a whole other category of, like, they just party too much, and then it was like, I need this all the time. Or an athlete, or someone who got addicted to pain medication. Or I mean, the addiction part of it is something else, but a lot of times there is a reason why people
Yeah, a few things I wanted to touch on with that. You're absolutely right. In my experience, the vast majority of people that we treat, especially in an inpatient setting, have some significant trauma in their past. A lot of times, more than one.
Yes.
But you mentioned a good point. Not everybody who becomes addicted is because of severe trauma. Sometimes it's chronic pain issues or injuries. Sports athletes, they never had a problem with addiction their whole life. They had a horrible injury. They got on the oxys, and boom, right back to it. So many paths lead to Rome, as they say sometimes. But the simple fact remains that it is a disease that needs to be treated. And it's not just the person who's suffering. Oftentimes, it's the family system or the support network around them that also needs help.
Yes, so much help. I mean, I can't stress that enough. If you are dealing with somebody who is an addict and don't think you're not feeling it. It's crazy. The first time I helped my friend get into this treatment, and he's in there, and then the friends that came to see him, we're walking outside, we're leaving, and all of them said to me, like, "How are you doing?"
Yeah.
They were like, "Are you okay?" And I was like, "What you talking about? I'm fine."
I'm not the one with the problem.
I'm not doing exactly what I'm saying to myself. I was like, but it didn't give me pause. It was the first time I started to think, like, oh, you know what? I'm not okay.
Yeah.
I'm not okay. Even to this day, if I'm around someone and I smell alcohol, it triggers me, I feel like, I feel like that thing, It's like a lot of things you deal with when you're dealing with an addict. Like, every time your phone rings, you think, like, oh God, what is this about? Every time you talk to them, and it's like, so right now, I'm in therapy with him. As part of to help him, and it's helping me.
Good.
Like dealing with, like, the resentment and the guilt, and also being like taking my own responsibility of being like, because I do feel responsible. I do feel like it was like I enabled you, and I'm sorry. You know what I mean? And that's a tough thing to, like, to realize.
For our listeners, when we're talking about enabling behaviors, I think it's important to clarify. What we really mean by this is, for someone who's suffering from an addictive disorder, oftentimes we will unknowingly help that disorder to continue by giving them money or giving them rides or paying their rent, like you mentioned.
Can I I know you're the doctor, but I got to step in.
Please, go ahead.
This is the main one. Not only do we, like, do those things, but the real problem we do is we don't let them deal with the consequences of their actions.
Yes, exactly.
We don't let them fail. Like, so if they don't pay their rent because they were drunk and they did whatever, didn't go to their job, and so now they're going to lose their apartment. If they don't feel that loss because we're stepping in, then what is their motivation to stop drinking?
There isn't any.
There isn't any.
Yeah.
And that's where the enabling really comes. And it's a tough, it's like, oh my God, I can't tell you how tough that is. Like, it's a tough thing, because when that finally hits you, and then you look back at the actions, you start to go, damn it.
Yeah.
I should have done this, and this.
Well, that's why it's important to have, your own support to
Yes.
help you deal with those feelings, because it was all out of love and care
Right.
and compassion. You weren't trying to fuel the addiction. You were
And
just trying to
that's
help
what makes it hard
Yeah.
because you feel like I did this things out of love, and
Yes.
and so if I don't do this thing, does it mean I don't love them?
The internal conflict.
Yeah, that's an internal conflict that is why you need help.
Yeah.
And therapy is the answer for that. When I always talk about therapy, I say the same thing all the time, is that therapy is not going to solve your problems. It's just going to help you organize your thoughts with a professional that recognizes patterns.
Yes. Yeah.
And so you might not solve the issue, but if you can understand it and where it's coming from, that might help you be like, I'm feeling this way. You know what? This is because of
Yeah.
A, B, and C that I talked about in therapy.
And the support groups as well, like you mentioned, I think is so important to touch on, is you get into a group of people who are suffering or going through similar things, and you realize you're not going crazy. There's nothing wrong with you. There are other people who are suffering from this. And let's face it, these days in the United States, you're more likely at this point to be touched by addiction than not.
Yeah.
With the amount of
Which is a
addiction we
shame.
have in this country. And the overdose death epidemic that we're facing.
Yeah, it's an epidemic. It's
Yes.
like, and, man, don't even get me started. It's crazy. Just in the comedy community, just recently in the past 6 months, there was, 3 comics died. They had fentanyl and, didn't know, or, they didn't realize how deadly that is. And it's just like, you gotta be careful out there. I always get mad. Sometimes it's hard not to get upset. It's hard not to get upset when you see there's some young actor who was taking heroin and died in a hotel.
Yeah.
And you're sitting there, you'd be like, oh, you thought you were the one that was going to beat heroin.
Right. Exactly.
You thought heroin seems to be undefeated.
Yeah. Eventually, it'll win.
Eventually, it's going to win. It's taking more. It's like a 15-round match. Even though you're still standing, are you the same?
I tell you, one celebrity death that really hit me hard was Chris Cornell of Soundgarden, one of my all-time favorite bands. And hearing of his passing, it just rocked me. And it's still to this day, I'm really sensitive around that topic. Every time I hear his music, I feel a real sense of loss and pain. Even though I never met him or knew him.
Right.
And now here again, we lose Taylor Hawkins of the Foo Fighters. The
Yeah.
drummer. We don't know the exact cause of death yet, but we do know there were 10 different drugs in his system, and he was alone in a hotel room, just like you just mentioned.
That's what I'm saying,
Only
man.
50 years old.
Or even when you find out about the one that got me is I was a huge fan of Glee.
Yeah.
And the kid on Glee, he was
20.
He was, but he was at a party,
Yeah.
and I always feel bad. It's like I think to myself, if you were at that party with him, you see what's going on. So you just, you know what I mean? It's not their fault.
Yeah.
But it's like, damn, how can you live? How can you not think about it? And I'm sure with your knowledge of what you do for a living, and it's like when you see this kind of thing happen, you feel like, man, if I had just been in this guy's life, even from afar, we have this sort of guilt thing
think
that
about
we
that
feel
all the time.
Yeah, of course you do. So of course you feel like, hey, I could save the world. You know what I mean? Oh, you just need to do A, B, and C, and I got you. That makes it even harder for you. So it's tough. I know. Yeah, man.
I can tell you two things that come to mind. I've been in this business a long time. I could tell you a million horror stories.
Right.
I could also tell you a million successful, amazing stories. The ones that really get me, and this has happened a few times in my career now, is we'd have patients come in for treatment who may stay for 30, 60, 90, 180 days, whatever, and then go out and they maintain their sobriety, and a year or two later they come back and apply for a job. And I've had several people come back after treatment a year or two later in sobriety and work for me. That has been incredible to see, and then become some of the best employees.
Yeah, well, that's funny you say that because what I'm dealing with my friend is it's at a place where they encourage that, and actually are
in recovery themselves.
So it's like you just go, who better to understand?
It's incredibly powerful.
Who better to understand? So it's like. But I didn't have faith. My faith was wavering for a long time for my friend, and it's. Now I'm starting to see the change in his thought process, which is where you need it to be.
That's right.
It's not because it ain't about being sober. It's not about not ever taking a drink again. It's about changing those reasons why.
Yeah. And staying sober.
And staying sober because you know what it does to you.
I can get anybody sober.
Yeah.
You know?
Exactly.
Give me 7 days in a locked room, no problem.
Exactly.
It's staying that way, after you leave.
And also, it's also like, you also like getting past. The other thing about the guilt is it's also the anger you feel, the resentment you feel. I mean, I just feel resentment sometimes, and I'm still trying to deal with that. It's like, how do you let it go?
I've seen you mention that before, and you talked about having boundaries. So talk about that a little bit.
Boundaries is like, okay, that was like the first. When I first had to go to therapy, I remember my therapist said to me, I have an exaggerated sense of responsibility. I was hooked. Because that's about, that is, in essence, boundary issues there too. Because like boundaries is like being able to say no. Boundaries are being able to like look out for yourself. But in that process, you feel selfish. So you feel like, it's like when somebody asks for your money that really needs it, you have to have the boundary to be like, well, no.
Yeah.
And then not feel bad about that. But that's the hard part because you make yourself feel bad about things. It's just having boundaries it's important. People, you can't let people, invade into your comfort zone because you're going to be a pushover. The people will take advantage of you, and you have to look out for yourself.
You have to prioritize yourself.
You have to prioritize yourself. I always use the example of like when you're on the plane. What do they always say?
Yeah, we use this a lot too.
You have to put the mask on yourself first before you can help anybody else. Because and so that is super important to remember. But
we talk about caregiving a lot in treatment with family members, and we use that exact example a lot. And the thing I talk about with family members often is they often want to be able to take care of the people they love, like we all do. But to be a really good caregivers, the best caregivers out there are the people that take the best care of themselves first. And then they're able to care for others more effectively.
Yeah, I mean, it's super important to be able to say like no and just be like be okay with it. It's like if somebody it's like I always tell people this is how I say if somebody asks you for money, a lot of times they ask like this: hey, is it okay if? Then you just respond with, sure, as long as it's okay if I say no.
Yeah, I like that.
Yeah,
I like that.
And if it's okay if I say no, please ask your question. But if you can't take a no, then don't ask me.
To our listeners out there who may be going through this right now or can relate to some of the things we're talking about, one thing I've talked to family members about quite a bit is to first learn about enabling behaviors like we're talking about right now, but then you also have to learn the skill of how to stop enabling, and that's really tough. And I'll tell you the hardest thing for parents usually is, well, what do I do if they leave your treatment center and they come home and they start using again? I'll put that question right back on them. Okay, what do you do if that happens?
Yeah.
And what I'm trying to get them to the point is, all of the enabling behaviors are cut off. But are they still living in your house and shooting heroin in their room?
Yeah.
What do you do in that situation? And the hardest thing for them to hear is kick them out.
I know. Again, this is, in essence, the hardest part. Because there is the possibility that it could go completely wrong.
It's true.
And that's and the thing is like this is a double-edged sword. And that's why looking out for yourself is important. But even if you're looking out for yourself, if something were to happen to your loved one, you're going to never forgive yourself and you're going to be devastated. So the point is, these are the extremes we're talking about. So I think that the point is when you start working on yourself, you're portraying something to this person to let them know they're not going to get away with certain things. The fact that they come to your house and shoot up and stuff is the fact that they know they can get away with it. So once you change that, where you become a person that they go to, like I pride myself on being a person like, you're not going to come to me with some, like, it's like anybody would be like, can I come to you and be like, hey man, can you hold this drug money for me? Like, if you're a person that they know they can come do that to, then you got to change what's going on with you.
Very good point.
You know what I mean? You change what's going on with you. So for me, I just feel like you have to become a figure of like importance. You become a figure of like a morality for that person. Like, not like to be like, hey, I'm better than you. It's not that. It's just that they know like, ooh, I can't get away with that.
Yeah, and for our listeners, they may hate you for it. You
Right.
start setting those boundaries and you stop enabling, they may hate you for it. They may let you know, and it might last for years. But they may end up getting the help they need and turning their lives around, and at some point coming back to you and saying, you know what, thank you for doing that.
Because they respect you.
Yeah, exactly.
That's the thing. You want that respect for your stance, that who you are as a person. And so that's the thing you have to work on, because it's easy to talk about the extremes. It's easy to talk about like, this is what, so now we have to talk about what happens after everything went wrong and now we're at this place. So we have to discuss, like, how do you work on it so you're not in that situation? You know, basically, you know what I mean?
Yes, absolutely. Yeah. You know, also to our listeners at home, you know, you were talking about the Glee situation, and that was another horrific story. It's not just opioids anymore that are causing overdose death. For those of you who aren't aware, there was over 100,000 overdose deaths in the United States in a fiscal year just recently, blowing away all previous records in the United States since they started recording it back in the late 90s. And part of the reason is that the drug fentanyl is being cut into lots of drugs like heroin, which is an incredibly deadly substance. But now it's not just heroin that we're finding fentanyl in. We're finding it in cocaine. We're finding it in methamphetamines. We're finding it in street-pressed pills like Xanax, repressed pills, repressed oxycodone. We're finding it all over the place in places you wouldn't expect it, and which is causing the overdose death rates to skyrocket. Like you said, you're at a party, people are getting high, people are using, they take the wrong thing. Maybe they're not even in the depths of addiction.
Jesus, I feel like if you're a drug dealer out there right now, it's like you should pride yourself on being the one that's like, I have no deaths. You know, I feel if I was going to get into the drug business, that would be my thing. Hey, don't worry, there's no fentanyl in my stuff. Come get, you know, it's like, I don't know what, you know, and so I know that the cops and the you know, the DAs and the FBI, they need to start going after, you know, everyone. So not just like, so you have the dealer, they're trying to get the dealer. But if the dealer gives like some stuff to someone, if you're someone and you bought drugs and passed them out at a party, I think you got to be held responsible too.
Yeah.
If somebody dies.
Yeah. And the saddest thing is most of the fentanyl is just coming in through the mail.
That's crazy.
From China. That's how it's flooding the United States. So we have a lot of problems in this country surrounding addiction and mental health. The pandemic has not helped.
Right.
It has vastly increased the symptoms of anxiety, vastly increased symptoms of depression. Suicidality in the United States was already skyrocketing before the pandemic began, and that has gotten worse. So we're at this point now where all of this anxiety, all of this depression, all of this trauma that we're experiencing as Americans going through, you know, through COVID is really hitting, kind of coming together in this perfect storm or this petri dish for an explosion of mental health problems.
Yeah.
And I talk about this a lot, and I still don't think that we've really even reached the pinnacle or understand the long-term effect that this is going to have on us going forward 10, 20, maybe even 30 years.
I completely agree with you 100%. And the problem to me is that we were so concerned about, you know, people talk about health and safety, but they were only concerned about safety. Wear a mask, stay 6 feet apart, don't be around people, stay at home. That's safety.
Right.
But we were not concerned with health.
Yeah.
And the health is how this is going to make people feel when they're alone. We didn't deal with that.
Yep.
We didn't deal with people's personal health. Like instead of mandating a vaccine, we should have mandated exercise. Okay, that would have been a better mandate. Mandate exercise, mandate like talking to somebody. Maybe mandate those things.
Yes.
I think that would go further. It would go further to helping people than just the vaccine. Okay, so like though that's the thing that we're like, and so now you're right, because right now we don't know what normal is yet. We're still kind of like, man, we just ruined our lives for 2 years, and now what? Are we back? We don't even know. No one's talking about it. We just kind of like, all right, open the restaurants again, and okay, take off your mask, but we're still like, yeah, but I just went through some stuff, man. You know, it's like walking through it's like walking through a haunted house. Of horrors.
Yes.
And we walk through this haunted house of horrors, and then when we're out, people are just going, all right. You know, but we're like, I just saw some terrible, and they're just like, okay, well, you know.
Pick yourself up by the
bootstraps. Yeah, pick yourself up and get out of here. And it's just like, we're still like dealing with it, and it's tough. And by the way, I think that like when we slapped the pandemic on us, what the toughest part about it was we didn't even realize all the things we had going on in our lives. You know, like you're sitting back like, we all have stresses and pressures and things that we were dealing with. And we didn't know really how much they were really affecting us until this huge thing was slapped on us. And then we were like, whoa, I'm really off balance right now. Now there's pressures of work and family and love and all these things. And if you have kids, if you have, you know what I mean? All those things became heightened because we had this thing that we have completely out of our control. And so, yes, I do feel like this will have long-lasting things. And so that's why I know the point of this, too, is to stress to everyone, don't be afraid or feel bad about getting some help.
Yes.
You know?
Yes, that is the point too.
Yeah.
You know, and when people like you come on these shows and talk so openly about that, it really helps to reduce the stigma around it and normalize it. You've said on other podcasts, I remember a conversation between you and Megan Trainor talking about how mental health should be like going to the gym.
Yeah, we physically, we work on our physical stuff all the time. We go to, Crunch or LA Fitness or whatever, and we work on our body because we know it helps. Like I just recently started working out more. I got a rowing machine and I feel great.
Yeah.
Like I feel better. I'm still not in shape, but just that movement that I'm doing is making me feel better. I'm going to bathroom better. I'm like, my mind is more clear. I feel my breathing is better.
Sleep.
My sleep is better. And so I go, so why not your mind have the same sort of working out? And that's just simply just talking about these things. And I know it's hard, it's scary, but just like working out, it's hard to do. And even while you're doing it, it can be difficult.
Oh, yeah.
But the result is you feel great. You feel better.
That's a good way to put it. And I've always told patients that I've worked with, if I could change 3 things about you with a magic wand: eating somewhat regularly and somewhat good,
sleeping better,
and exercise.
Yeah.
Wave my magic wand. All 3 of those things are in good shape, and you'd be amazed.
I go to again, these are the things we should be mandating, right. But anyway, so I go to this health place, Next Health, shout out to them. It's all about preventative medicine as opposed to, reactive medicine, if that's the word.
Yeah.
But anyway, the thing they ask me all the time. These are the things they ask all the time. No matter what, vitamins, whatever, it's always, how are you sleeping?
Yep.
Like, and I go, okay, I know, I'll get to bed early. It's like, it always becomes that. And it's such a simple thing. It's like, how are you sleeping? What are you eating?
Yep.
And then you got to get the movement in. And, it also becomes what people, to me, they don't, you have to unpack things. There's nuance to things. So there's a difference between having a great physique and being healthy.
Right.
But, when we think of working out and stuff, I think that people's mind, it's all about having a great physique.
Yeah.
Well, I want to look good naked. Like, that's our goal.
Right.
Want to look good naked. Not realizing that being healthy has nothing necessarily to do with that. If this is being healthy, it's just about how it really affects your heart, your mind. My mom has dementia. So, and I just turned 50. So it hit me. And and you look up dementia and it's like inflammation, high cholesterol, high blood pressure. These are things that you actually can control. These are things that you may not still stop it, but it's like, I know my mom wasn't working out. My mom wasn't necessarily eating well, even though she was a slender woman. So she's a slender woman. So for me, it's like I said, I need to fight. I need to start working on this sort of thing. And so as you work on your body, so I think it's the same way I think we can work on our mental health. But mental health has got such a stigma. It's such a negative term now. It's turned into some sort of bad word. And let me just tell you, again, when you go sit down with a therapist, they are a professional. They recognize patterns that they've seen throughout their whole life and their experience, what they've clinically learned how to see that, because if this happened with your mother and father, you're feeling this way. Just that little nugget might help you go, now I get why I have this. Like I learned in my therapy, I don't know my father. I've never met my father before. So it's I'm an only child, single parent. And going through this therapy with my buddy, it's he said, well, I think you have abandonment issues. Never thought of that before. Because you go, well, I've always my whole life been I've never met my dad, so I don't know.
Right.
So I've never experienced it. To me, I always thought if you were 7 and then your father left, that'd be worse because you experienced him. But for me, I've never experienced that. But then I started to see how that actually has affected my life. Because if I see how what we consider normal is to have 2 parents, and I've never had that, and then there's part of me that probably was I wonder why, And so anyway, my point is, I I'd never considered that before.
Yeah.
I never considered it, so I started to think about it in a different way and see how it's affecting other relationships, other things in my life. And so that's the kind of stuff you kind of like go through in therapy. You have to have this outside eye who's a professional to be like, hey, and by the way, if it's not working out, just like any relationship, if you feel uncomfortable, move on to the next.
That's right.
It's fine. Like if you feel like, because this is a human being, these doctors are human beings and they have feelings and wants and desires and needs and they have their own issues going on. And if you feel like, you know what, we're not meshing.
Yes.
Then that's your time to go, it's not the therapy that's not working. This relationship isn't working.
Yeah.
Let me move on to another one.
It's okay to say that in therapy.
It sure is. I have friends of mine that have been in therapy and they're like, my therapist seems to be like blah, blah, blah. I say that to them.
Yeah.
Because you might be letting them know, oh, you know what? I'm letting some, maybe I'm bringing my personal stuff into this.
Not every therapist-patient relationship is made in heaven.
It's not made in heaven.
It's okay to try again and try a different one.
Flirt, you know what I mean? That's why I love a lot of these online things too. It's like Tinder, you know what I mean? Swipe, you know.
Next therapist.
Next therapist. Like, ooh, this one is an expert in boom, boom, boom. I like the stats, and then you just find another one, and then like, you know. But again, I know how hard that is too, because once you've established a rapport, it's like my therapist from before. She retired, and it was like I was devastated because I'd done all this work and I opened up. But then I thought to myself, you know what? I'm already ahead of the game. So like if I get with another one, I know where to start.
That's right.
You know, I know I'm like, hey, this exaggerated sense of responsibility. I had these boundary issues. I'm working on them. You know, this is something. I know where to like get this person caught up, and I feel like okay. But you know, for me, I'm always curious. Therapy makes me curious. I'm curious about myself.
Yeah.
And I like that. Like I liked like learning, like, ooh, I didn't know that I felt that way. And it's like, oh, okay, ooh, this is because of my mom. You know, I think that there's like a curiosity that you should have about why you feel this way. Like, why do I feel this way? Why am I depressed? Why am I feeling anxious? Why am I fearful? Why am I living in fear and all these kinds of things? Go talk to somebody who will be like, well, it could be simple.
And you bring up a really good example that a lot of people go through is you found out by talking to someone that maybe there is abandonment issues, but you buried it so deep. Yeah, and you had the psychological facade to cover it, so it's not a problem.
Yes.
I never knew, no big deal.
Yeah.
And you went through most of your life like that, but then you found out that seed was sprouting.
Right.
And it was affecting relationships and affecting other areas of your life. And it doesn't have to be a chronic, lifelong thing. It can be treated, you can get past it, and you can move forward.
I saw someone else talking about therapy, and like this is another. I need to put this message out too: is that it's not always a huge change you're going to make in your life. That's something that you need to understand too. It's not a huge change. I often talk about my own career, my career path. It's like my analogy is like I'm on a treadmill, and the incline is set to 1. So as I'm going through my career, I think, well, have I done anything? But if you look back after a time, even an incline of 1 can take you very high.
Oh, yeah.
So in therapy, I feel it's the same thing. It doesn't have to be, I got to make this huge change.
Yeah.
Sometimes it could be a small alteration. So if I have these two, if I'm pointing this way like this, and we're going this way, if I just make a very slight change and start going like this, it's going to take a lot. Like, you're not going to realize how huge that difference is going to be later.
Yeah. Consistency over time.
Consistency over time. Anyways.
Absolutely.
My other life, my next life, my calling will be, I want to do this maybe. I always think I should go to school and like, you know, finish it up.
You know, when I was in my residency, I was forced to be in therapy for about half a year.
Oof.
I'm a psychologist.
Yeah.
I did not want to do it.
Of course you did.
I was totally against it. I went in there thinking I knew everything and I was this hot shot and you're not going to do anything for me and this is going to be a complete waste of time. I will tell you that was the most powerful 3 months of my entire life. I had no idea what I wanted to do when I got done with my residency as a psychologist.
Wow.
8 years in school, no idea what I wanted to do. That 3 months got so deep and I felt so good about my path forward after working with her that I'm forever grateful to her.
Yeah, you hear? Yeah, well, you heard it here. That's exactly what we're all saying. It's like break that stigma. get some help.
So Eric, your comedy brings a lot of people joy, and God, we all need it. Any upcoming tour dates, TV shows? What are you working on?
If you go to ericgriffin.com, I'm going to be in Houston, and I'm adding more dates to my calendar. So I have a lot of things going on. I live in the LA area, so I'm always at the Comedy Store and the Laugh Factory and the Improv. You can see me there. The April 4th, I believe it is, or April 5th. It's the first Tuesday of April. I'll be at Flappers in Burbank during my show, Eric and Friends. So come check me out there. And, again, a lot of times, even on my podcast, Riffin' with Griffin, check me out on that. I do a segment called Real World Advice from a Grown-Ass Man. I'm not a professional, but I'm just giving you my, just tell, hey, you tell me something, and I go, hey, this is how I feel about that. Take with it what you will. So listen to my podcast. I game every day on Twitch. I'm doing all kinds of stuff. So,
right. How did you get your start in comedy? That's one question I wanted to ask you.
I don't know. I was on that low incline treadmill. I always thought I was funny, and then I just did it. I took a comedy class, and then I took a lot of time off because I didn't know what the hell I wanted to do, and then I just did it. I started going to the open mics, but I did it later. I really started when I was 30. I took classes and stuff. I took a class when I was 22. I was trying to go to open mics, but I just didn't have it. I didn't know I didn't have the wherewithal. Then when I was 30, personal life things changed, and I was like, well, what do I want to do? Because you know what? I didn't want to wake up 50 and be like, I didn't follow my dreams.
Right.
Just turned 50, and I feel like I did it.
Consistency over time again.
Consistency over time.
Thank you, Eric, so much for speaking with me today. I can't tell you how much we appreciate it. I really hope our conversation today has helped someone. I know that we've reached out, someone has heard the message, and will be better off for it. So until next time, everybody, be well.